Malaria remains the leading cause of morbidity and mortality in the country despite control efforts. The manager, Malaria Control in the Ministry of Health, Dr. Jimmy Opigo, explained the basis for the new statistics.
One, our mosquito net coverage went down so much because of misuse and abuse, so there's been no coverage. Also, resistance to chemicals we use for mosquito nets and spraying IRS has been a problem. We also think the malaria parasites have increased their virulence and ability to evade the medicines we have for treatment. With this, what is really required is to focus on prevention and early treatment, because right now malaria can quickly progress to very severe forms, presenting in several forms like black water fever, which is passing blood in urine, kidney damage, and even respiratory distress syndrome, ahead of what has always been well known about malaria, like severe anemia and cerebral malaria.
Now, the government says incident management approach used to deal with COVID-19 and recently Ebola will be deployed to turn the tables on malaria.
And that's why you have reactivated their district task forces to now focus after Ebola, after COVID. Let us now refocus all our minds to malaria. And we are all now set.
This follows reports of a worrying rise in malaria cases in 10 districts in mainly eastern Uganda, Lango, Chigezi and Bunyoro sub-regions.
Government, working with its donors, has already procured over 28 million mosquito nets this year to give to all Ugandans. Right now, as we speak, the National Medical Stores has over 6 million nets ready for deployment. They have been having challenges of financing for deployment, but you can see in this meeting today, a decision has been made to leverage whatever system of government.
We gave a directive to commission our people. Today still talks about still mobilizing logistics when people are burying their children. For me, I see ourselves as not considering malaria to be an issue.
Nabbanja said the most affected areas should be given mosquito nets as a top-gap measure and fast.
So you just need to tell us 1, 2, 3 and we move the way we have been moving.
Don't believe in moving in circles. Colleagues, I am Muchigaman. I don't believe in this thing of speech, you take tea, you get diabetes, nothing is done. Why can't we get money now? And we just pick money. This country, we are a big country. And we get some small little bit of money. NMS now pushes the mosquito nets, that thing, and up you go. You have the money from donors. Why don't we get this money and you go and we spray Chibuku tomorrow?
According to Ministry of Health figures, malaria accounts for 30 to 60% of outpatient care and 40% of missed school days.